in living color, building trust through representation and medical illustrations. We have the world-renowned cardiothoracic transplant surgeon, scientist, and global health scholar, Dr. Jarvis Swan. His work focuses exclusively on augmenting access to clinical education and care delivery for cardiovascular diseases within resource-limited settings, such as Rwanda and Haiti. He has lived in these areas and provided support to projects designed to strengthening healthcare infrastructures for critically vulnerable populations in resource-constrained settings. Bringing out Dr. Jarvis Swan. Maybe I'm announcing him prematurely. Are we ready for our next session? We are? Okay. Well, then I will go ahead and continue to introduce our next powerhouse panelist, Dr. Shalina Ramnaran, who is the Director of Our Race to Health Equity Community Engagement at Johnson & Johnson. She is a native of Trinidad and Tobago who holds a strong value for the community. She is renowned for being the change catalyst as she successfully takes innovative ideas from concept to execution. She is truly a community cultivator who works to create spaces to foster dialogue, blending head to heart towards solving unmet needs. Let's have a big hand for both of them.
Is this one on? Okay, great. We are in business. I am so excited to be with you all here today. How y'all doing? All right. I like the clap back and I like things to be interactive. So we're going to have a discussion today about a project that we've been working on called Illustrate Change. Okay, that's how we advance the slides. So today we're just going to give you a recap of what is Illustrate Change all about, and then I'm going to have a discussion here with Dr. Jarvis Swan about the importance of medical imagery in medical education. So hopefully the slides will be quick. So please raise your hand if you often feel like imagery in the doctor's office does not represent you. How many of y'all feel like that? I feel like that too, I get that. And have you ever been diagnosed incorrectly by a healthcare provider and felt like it was because of the color of your skin? I see some head nods. Yep. It's definitely something that, a lot of people have a lot of questions about. So to demonstrate what Illustrate Change is all about, I would love for us to watch this video if it will play. I'm not sure how to play the video. Does it play? I really don't know who I should be looking at, so somebody tell me if it plays. Okay, it's not going to play. All right. But what you would have seen in the video, it's an animated video about a young mom going to the doctor. She's pregnant. And what you might not be able to see very well is on the inside, it's actually an illustration of a black fetus in utero. And so she goes to the doctor, and there's an illustration of a black fetus in the womb, and it kind of makes her feel better because there's illustrations and imagery that responds to her. And so we have this quote basically saying, I find myself Googling a disease and dark skin just so I can see how it impacts me. All illustrations and photos show white people. So imagine how challenging it must be when you go into the doctor to get care and you're not even represented in that setting. And you're asking yourself, has this doctor been trained on people that look like me? Are they really able to provide care for people that look like me? And so as we started to understand this, we went to the literature to say, has this been studied? What do we know about this? And we know that 47% of dermatologists and dermatological residents in the US thought that their training was inadequate for preparing them to identify and treat conditions on dark skin. That's a high percentage. That's almost half. That's a lot of people that we see every day, and we're wondering, do you even really kind of know what's going on with me? So you can see the problem is building. Here we have another statistic that says 64.6% of medical respondents note that access to inclusive medical illustrations would significantly help them diagnose and treat patients of color. So it's a gap on the patient side, and it's also a gap on the provider side in terms of them getting the education that they need and patients feeling seen. And you all may or may not know this, but 7% of active physicians in the US are Hispanic, and less than 6% are Black. So we're not really going to be able to produce enough Black and Hispanic physicians for us to all be able to see a doctor, but we need to ensure that all medical professionals that we see are able to treat Black and Hispanic patients, right? Patients of color, we know, are more likely to seek help with practitioners that look like them because they can understand, they can relate, they know what things look like on that skin. So we do a lot of work with diversifying the pipeline of healthcare professionals, but as I mentioned, we're just not going to be able to get enough Black and Hispanic doctors in time. So it's also important to properly train all of the other doctors that we're seeing. So Illustrate Change is actually an initiative to build the largest medical library of medical illustrations. So it started off with 25 illustrations and actually started off from some research we were doing on maternal mortality in Atlanta. We were trying to understand why the rates of maternal mortality are higher in Black women. And one of the things that came out of the market research was that patients, when they went to the doctor's office, didn't feel seen because there was no imagery that represented them. And doctors felt like patients really weren't taking charge of their care, but they really wanted to, they just didn't feel included. And so Illustrate Change is an initiative that will help us really just have more representation in healthcare, and these illustrations are actually available on the website, free of use. For those of you that may work at a health center, or also individuals that are patient-facing, so patient advocate organizations. The illustrations are available for you to download and use them in whatever setting that you like. And so here are some of the illustrations, and Dr. Swain actually worked with the team that created some of these, so he'll tell you more about it. But this was a collaboration with Johnson & Johnson, the Association of Medical Illustrators, so only 6% of medical illustrators are people of color. So we really wanted to diversify the Association of Medical Illustrators, and we gave a grant in order to do that. So they have been working with us to produce 100 illustrations as we build this library. Peanut is an initiative aimed towards supporting women during pregnancy, and they also created 150 illustrations that are also on the website. And as you can see, they're visually stunning, but also very important for patient and doctor interactions and communications. And here's a couple of them. And it was so fascinating when we started this project because we would talk to physicians like Dr. Swain and say, when you were in medical school, how many times did you see illustrations on darker skin? And we found that less than 5% of medical images are on darker skin. And they would tell us, actually we were on with a physician that was trained in Brazil and also in Kenya, and they actually use our textbooks or those that are in the UK. And most of the time when they saw an image of a person of color, it was in diabetes, sexually transmitted diseases, alcoholism, so it was in a negative connotation, which further perpetuates that idea and stereotype about people of color. So now you will be able to have medical illustrations in a variety of disease areas. And so you can think about sitting in a classroom in Kenya and now being able to see something other than, you know, a less diverse textbook. And then Black people, as I mentioned, appear in fewer than a quarter of images depicting cancer. And so that's really important because if you're a patient and you're trying to understand what does something look like for me, and we know that breast cancer, for example, is different in Black women, they tend to get triple negative breast cancer, you want illustrations that you can kind of relate to and look like that on your skin. And so why illustrations? Some people have asked us that, like why not images versus illustrations? If you see some of the images, they're slightly off-putting. They're very important in medical practice, but the illustrations are a little bit more accessible for people of color in terms of patients and having those discussions. And also, this is an illustration depicting the importance and the utility of illustrations. They still are used, particularly in patient brochures and other kinds of settings. And as I mentioned, we are building the largest library of diverse medical illustrations. And the goal is really when patients see themselves depicted in medical illustrations, they feel understood. So kind of going back to the origin of where this project came from, we really just want people to feel seen when they're in medical spaces and have confidence that their physician has been trained and is able to provide them the care that they need. So we know that photos have limitations, as I mentioned. Illustrations can be really able to reflect particularly internal body parts with a level of precision. So Dr. Swain, I'll ask him about some of, he's a cardiothoracic surgeon, y'all. So I'm gonna ask him about some of the internal things that we can see in illustrations. And this video would have been a nice closing to go with the original video, and it would have shown you knee replacement to just continue what I was saying about the internal depictions. And so the video would be able to show you a chef who's continuously on his feet talking about the knee pain that he had. So I am now going to move out of PowerPoint because chatting is much better and have a dialogue with Dr. Swain, who has been involved in Illustrate Change from the very beginning. So Dr. Swain, would be great if you could tell us about how Illustrate Change got started and how you became involved in the initiative.
Absolutely. So first of all, thank you for having us here. This is an excellent opportunity. I think oftentimes when we talk about Illustrate Change, people are like, well, why is this important? But I challenge everyone, if you'll take a moment to Google psoriasis, Psoriasis. But when you do it, all the images that come up are going to be of white skin. And so think about when you go to a physician or a dermatologist and you show them your hand or show them, pull up your shirt and show them a rash, you know, a lot of them will have to go to a medical resource to try to identify what the rash is. But the overwhelming majority of those resources are depicted on white skin. And so for that reason, a lot of times different disease processes that we may have or conditions that we suffer from will show up differently. Psoriasis on white or pale skin looks very different from darker skin. And so sounds crazy, but I remember when I was growing up, there was a young woman who had darker complexion on her back of her neck. People was like, oh, they need to shower, she's not clean, she needs to wipe her neck. But that actually is an indication called acanthosis nigricans, and it's an indication that the patient may have diabetes. But if that's not depicted from an illustration or a graphic, then that's something that can be missed. And so, you know, those are like real life examples of why illustrations that demonstrate cultures and identities from a variety of backgrounds are really important. And especially as we move into this era of innovation where, you know, everyone now goes to, you get your portal results, everyone now Googles every word on the report to try to figure it out. And we now have ChatGPT, and you can do the same there. But again, it's critically important that we have an opportunity to really see ourselves represented, and not only to assist physicians in their diagnosis, but also making, you know, patients feel like they belong and that the condition is speaking to them. I'll use one final example and turn it back over to you, Shalina, where we created a campaign about peripheral artery disease. And for those who don't know, peripheral artery disease is something that affects many Black Americans. We're actually 2 times as great of a risk of developing peripheral artery disease than white Americans. And that disease process, if it becomes undetected or untreated, it can lead to amputation. Peripheral artery disease is probably one of the more common consequences of things like diabetes. And so there's actually an issue across the country where men of color are being amputated at a much higher rate than any other group across the country. And so because of that, we at Johnson & Johnson took it upon ourselves to try to create resources that would help provide education for those communities. Well, obviously, our context was to just, show depictions of a leg with peripheral artery disease and an amputation to illustrate the consequences. But we put them up in Black barbershops. And the people who were attending the barbershop was like, Doc, that's not my leg. That doesn't look like me. So we missed the mark in making sure that it illustrated the actual patient that we were trying to communicate with. And so we have since gone back and made revisions, and we've been much more effective at educating and sensitizing the community about this disease that has affected many people of color and continues to do so. So that's an example where it's the responsibility of the provider, but also of the community to come together and to understand how the disparities are being perpetuated. And I think Illustrate Change is one opportunity to try to address them.
Thank you so much for those examples. I absolutely agree with you with psoriasis. I watch a lot of TV, so I'd always see the psoriasis commercials. And for the longest, I was like, do Black people get psoriasis? Because I never heard about it in the Black community. And working on this project, now I know on darker skin, it can be gray, which is completely different than it being bright red or pink. So it's so important to have that education. And I think you spoke to a little bit of this, but could you tell us about the importance of this from the medical education perspective as well as on the patient side?
Absolutely. And so I know physicians at least, and also nurses and other healthcare professionals, when we go to do or learn gross anatomy, the essential Bible of gross anatomy is the atlas or textbook that was created by Netter. And it's sort of the holy grail of gross anatomy. And all of the depictions are of non-Black individuals. And so the entire population of physicians that have been trained over the last 100 years or so have all been trained on white imagery in order to understand. And so you even have like medical students attending as fellows and even retired physicians who may not have ever learned what certain conditions look like on Black skin. And so I think now there's an opportunity to create an awareness, not only within medical providers, but also within medical illustrations, such that we can have a much more diverse opportunity to display some of these conditions. And it will help train medical practitioners in the future such that there's not a delay in the diagnosis, because part of the challenge is that if you haven't seen it on Black skin, you may be guessing or you may call it something else. And that guesswork is delaying diagnosis, which again is adding to the disparities that we see in healthcare.
Absolutely, right? If you don't get the right diagnosis, you might get the wrong treatment. We actually have a partnership to be able to do more research on this with Columbia University. And the statistics that I showed earlier in terms of the percentages of medical professionals that were not trained in patients of color were very small sample sizes. So there's also a gap in the literature in our understanding about the impact of this on patient outcomes. So the work we're doing with Columbia, they are going to be researching 500 healthcare professionals to understand when they're trained on skin of color versus not, so that we could get more data to say, hey, this really causes a difference in outcomes. And so far in their preliminary research, they have quotes from ER physicians that will say, I think I misdiagnosed this patient, but I'm not really sure. Because my understanding, Dr. Swain, is you kind of have to have an idea of what you think the patient has to look that up in the portal. Is that how that works?
Yeah, absolutely. And so a lot of time, unfortunately, it's the practice of medicine. And so while there are a number of things that we learn from, clinical practice and we see over and over again, and you can easily look at and diagnose quickly and treat, there's still a lot of zebras out there, and even common things. Again, they present very differently on darker complected patients. And so I think it's really critical for physicians to become better educated on the different presentation of things, and it's not only just like skin disorders. There's also other type of like challenges that we face and disease processes that are endemic to Black people that we just need to become better at recognizing and diagnosing. I'll give you another example. People who have heritage from West Africa tend to develop a cloudy ring around their eye. It's called arcus senilis, and it's fairly benign when you see it in older patients. Sometimes it looks like they initially may have started out with brown eyes when they were younger, and then they kind of slowly gray. Well, that has often been confused with a cataract or glaucoma. And so, but it's a natural occurrence, particularly for folks who may be from West Africa. But that again is something that is not as clearly depicted in the literature in regards to graphical illustrations. And we're hoping again to break into that dialogue, and this is just the first step. Illustration will not stop the disparate care that we are seeing across the country that is being administered or withheld from people of color, but at least this will start the dialogue of how important it is to not necessarily treat every patient equal, but treat every patient appropriate. And so equal care does not necessarily mean that you're even getting the right care for your condition. There are some that are sicker than others, and there are some who express pain in different ways. And I think our health system, as well as other systems, have often vilified people of color and put us in a position where we have not received the appropriate care just given the color of our skin. And so our hope is that Illustrate Change will be the beginning of a dialogue understand that there are indeed differences. And it changes over time. There was a campaign that said separate but equal. Yes, we are separate, but we still haven't been equal in the way of the treatment and the care that we've earned and received in the healthcare infrastructure. So my challenge to each of you, in addition to Googling psoriasis and determining whether or not there is enough illustration of people of color, but also empower each of you to take ownership of your health as well as the health of your community so that we can begin to see systemic changes across the country.
Absolutely. There are so many reasons why people that look like us are not getting the care that we need and deserve. And I think that Illustrate Change is not going to solve everything. But to your point about the beginning of a dialogue and raising awareness about how we have been excluded, most of the times when we talk to somebody about this project, they're like, I never thought about what doctors were being trained on, which is true. Like, that if you're not a part of that world, you might not think about that. But if you don't have the appropriate education, that impacts the care of your patients. So hopefully you leave this conversation a little bit more knowledgeable. And to echo Dr. Swain's call to action, definitely important to be your own advocate, take charge of your healthcare, and share with others around you that may not have the information and resources that you do. So thank you so much for your time today. This has been wonderful.
Thank you.